Hello everyone, and welcome to the 7th section under Patient Assessment, titled Performing the Secondary Survey. As always, this is Keith Woodmeyer with Wayne County EMS. Alright, let's get started. Typically, a secondary survey is typically a head-to-toe examination. The reason for a secondary survey is performed is to find other injuries or signs of illnesses that may affect the emergency care you provide. This examination is performed only after you have found and treated all life-threatening injuries and illnesses. Secondary surveys is patient, situation, and time dependent. For instance, a patient with an isolated injury, such as a painful ankle, would typically not require a head-to-toe physical examination. However, a secondary survey should be performed in the following situations: trauma patients with significant mechanisms of injury, trauma patients with an unknown or unclear MOIs, trauma patients with an injury to more than one area of the body, all unresponsive patients, all patients with altered mental status, some responsive medical patients as indicated by history and focused physical examinations. The phrase physical examination implies a head-to-toe assessment of the patient's entire body. A quick secondary survey head-to-toe assessment of a trauma patient with significant MOI is called a rapid trauma assessment. A significant mechanism of injury is one that is likely to produce a serious injury. A quick secondary survey of a medical patient who is unresponsive or has an altered mental status is called a rapid medical assessment. The phrase focused physical examination is used to describe an assessment of a specific body area that relates to the patient's illness or injury. When examining the patient, first inspect and auscultate, and then palpate body areas to identify potential injuries. Because it can cause pain, palpation should be performed last. Use your stethoscope to auscultate the movement of air into and out of the patient's lungs. Use your sense of smell to identify unusual odors during the exam, such as alcohol on the patient's breath, body, or clothing, as well as the odor of urine, feces, or smell of sweet, fruity odor, such as ketones that comes from diabetic emergencies. The mnemonic that we utilize when performing our head-to-toe physical examination is DCAP BTLS. That is deformities, contusions, abrasions, punctures and penetrations, burns, tenderness, lacerations, and swelling. I'll say this again. That is deformities, contusions, abrasions, punctures and penetrations, burns, tenderness, lacerations, and swelling. This is something that you will need to memorize. Again, that is deformities, contusions, abrasions, punctures and penetrations, burns, tenderness, laceration, and swelling. Again, deformities, contusions, abrasions, punctures and penetrations, burns, tenderness, lacerations, and swelling. Be aware that your patient will be anxious about having their clothing removed and having an exam performed by a stranger. Ease your patient's fears by explaining why you are about to perform this examination and what it is that you're doing. Remember to properly drape or shield an unclothed patient from the stares of others. Conduct the examination professionally and efficiently, and talk to the patient throughout the procedure. If your patient is a child, ask the patient or family member to help you. Doing so should lessen the child's anxiety. Vital signs are an assessment of breathing, pulse, skin, pupils, and blood pressure. Measuring vital signs is an important part of the patient assessment. Vital signs are measured to detect changes in normal body function, recognize life-threatening situations, and determine a patient's response to treatment. The history of a present illness is a chronological record of the reason a patient is seeking medical attention. It includes the patient's chief complaint and the patient's answers to questions about the circumstances that led up to the request for medical help. The chief complaint is the reason the patient called for assistance. It is best to document the chief complaint by using the patient's own words and quotes. For example, "I can't catch my breath." If the patient appeared stable at the end of the primary survey but becomes unstable during the secondary survey, expedite patient transport to the closest appropriate medical facility. And this concludes the secondary assessment section under patient assessment. Next, we're going to follow up with secondary survey by going on to the head-to-toe physical examination.